Hi, I'm Dr. Doni, and I know that many of you are struggling with health issues, and you might be wondering if leaky gut has anything to do with it, or maybe you didn't realize that leaky gut might have something to do with it. So I wanted to share with you several cases of patients I met with just yesterday who all have leaky gut underlying their health issues, just so you can get a sense of and relate to maybe what's going on for you. So this first case is a woman who has been working with me for about 4 months. She first came to see me because she has autoimmunity and pain. She has severe joint pain, and yet she doesn't want to have to be constantly relying on pain medications in order to manage her symptoms. And so we did the food sensitivity panel that I recommend, and we identified leaky gut, severe leaky gut, as well as her specific food sensitivities. And then I helped her to modify her diet and to start working on healing leaky gut. And she felt so much better, even within several weeks of starting, and now is continuing to feel better and knows what to do. Now she knows her protocol of how to continue working on healing leaky gut going forward, because when a person has autoimmunity, we know from the research that leaky gut is behind the scenes. She also had imbalanced gut bacteria, which I helped her to address. And so now she has her gut bacteria balanced. She knows what to do to prevent leaky gut from getting worse, and she knows how to keep herself out of pain, which is I feel so excited, because then she gets to go off into maintenance for herself and to know what to do, and she can always call me if she needs to. The second case is a patient who worked with me a number of years ago, and she had SIBO at that time. She had bacterial overgrowth, and she ended up deciding to treat it using the antibiotic treatment. She had a bacterial overgrowth of the small intestine. And then she subsequently started getting hives. Hives is otherwise known as urticaria, where you just get randomly these red splotches, which are sometimes itching and burning. Very uncomfortable to have these hives happening every day and randomly, different locations all the time. And she also then went on to have another bacterial infection in her intestines that was also treated with antibiotics. And right now, she came back to see me after several years because the doctors are just basically giving her Zyrtec to manage the hives. And she's treated the bacterial infections theoretically. But what I said to her yesterday is that I think when the bacterial infections were addressed in her gut, the leaky gut wasn't healed. So that's the thing. Even if you treat the infection, if we don't actually go through the process of healing the leaky gut, it ends up creating symptoms in other areas of the body. And so I think that's why she's getting hives, is because her leaky gut was never fully healed. And so I want to go back and help her heal the leaky gut and identify if there perhaps are still some imbalanced gut bacteria, because here's the thing is the standard tests for imbalanced gut bacteria that the doctors do doesn't pick up on everything. We need to do a specialty test. This is why I use these specialty tests for food sensitivities and gut bacteria, the DNA analysis of the gut bacteria, so that we can really figure out what's triggering. And often if it's something happening on the skin, it's coming from the gut. Which this next case also is an example of that. This is a woman who's in her 70s. She's been a patient of mine for over a decade, and she comes to see me every so often for when something is aggravated. She had originally colitis, which is a more severe digestive issue, and her colitis is much better. She goes through most of her days feeling good, but she came in yesterday because she was describing that she gets this burning redness behind her ears and burning in her mouth. And she's like, what is going on? And I just talked to her for a while. I said, well, what have you been eating differently, right? Because if she's already knows her food sensitivities, she already avoids gluten, she already has healed leaky gut, but I'm like, what's new and different? Turns out it's the summer. She's a gardener. She has tomato plants in her yard, and she eats these cherry tomatoes all day long. And what's happening is she's having an allergic histamine inflammatory reaction to all the tomatoes that she's eating. And it's causing all of this reaction in her. Not only that, but she had sinus congestion and a headache all in this area from the tomatoes. So I said to her, stop eating the tomatoes. And we need to be antihistamine, and we need to heal this leaky gut again. I think the tomatoes caused more leaky gut for her. So we're going to have to get back ahead of it again, right? So sometimes, even if someone works on leaky gut and is doing really well, sometimes some life happens. We're human. We're going to enjoy tomatoes in the summer, and we might actually end up aggravating something. But I'm so glad she came and told me about it, and so we can get on it and help her solve it. She doesn't want that to get worse, and she doesn't want to have to be on medications. It's going to be much better if we just help her body heal using herbs and nutrients, and which is what she prefers too. Okay, so here's another case. This woman is in her 30s, and she before coming to see me, she's a pretty new patient. She previously had autoimmunity, or probably likely still has some autoimmunity that caused hair loss, alopecia, and which was treated with cortisol or steroid treatment, which is a common treatment for a lot of different kinds of autoimmunity. But again, underlying autoimmunity is leaky gut. So I already, just when someone says they have autoimmunity, I'm thinking, okay, there's leaky gut somewhere, and probably some imbalanced gut bacteria, because those are also associated with autoimmunity. But she's coming to me saying that her main symptom is bloating. She's been to the gastroenterologist. They can't figure out why she's getting all this bloating. She also happens to have hypothyroidism and Hashimoto's, which is also autoimmunity. And so she says to me, how am I going to solve this bloating? So I say we got to do a food sensitivity test and a stool panel to identify what's going on with the gut bacteria. Anytime anyone has bloating up high in their in burping, I also recommend doing a SIBO breath test, which I recommended for her. We don't have those results back yet, but the results we got back yesterday showed me that she has severe leaky gut. She's reacting highly. And again, this is because the panel I do makes it so clear. I run IgA, IgG, 96 foods, and I can see exactly what's going on. I can see that she has high reactions to dairy proteins, egg white, egg protein, gluten, all forms of gluten, barley, rice, spelt, and wheat. And not only that, she's starting to react to bananas, pineapple, and almonds, which tells me that definitely this is a severe leaky gut. So I say to her, we have to work. She's not at all been working on healing leaky gut. I'm like, she has Hashimoto's, alopecia, both autoimmunity, and she's got all this bloating. She's been to the gastroenterologist. Nobody told her about leaky gut. So I'm saying we have to focus on healing leaky gut, and we're also going to work on addressing her imbalanced gut bacteria, because we got her stool results back too, and it showed the high levels of the type of bacteria that trigger autoimmunity. So we're going to work on addressing all of that. And I can't wait, because she's not only going to get the bloating to go away, but we're going to get this autoimmunity to go away too.
Something a lot of people don't know is that too much stress can actually create an abundance of health problems like high blood pressure, high blood sugar, anxiety, migraines, insomnia, even fertility issues. This is because high stress puts your adrenal glands on overload. They release cortisol and adrenaline, which controls your digestion, hormones, immune system, energy, focus, and even your emotional response. So how can you beat stress when you don't know where to start? That's why we have a free 7-day stress reset program. It's designed to help support weight loss, digestive healing, and hormone balancing. It includes support for integrating self-care, daily tips come to you by email and video, gluten-free, dairy-free meal plans, as well as grocery shopping lists, journal pages, and more. This free program will help you beat stress and put you on the path to wholeness in your body. Get your plan now for free at drdoni.com.
Okay, so then I have one more case for you, which is a male in his 40s. He's been a patient, again, for a number of years for various things, but this time he called me because he says he's been dealing with all of this severe bloating and abdominal pain for the past several months. He's been to gastroenterologists again. The patients are done their due diligence to go to the gastroenterologist. He had an endoscopy, he had a colonoscopy. So did the prior patient who I was just talking about, had an endoscopy. They cannot see leaky gut on an endoscopy. So the endoscopy just says maybe there's some redness, or maybe they say take a antacid, which is what they did in his case. What happens, sometimes you need to take an antacid, but what happens is when you take an antacid, you're turning off your stomach acid. So now you're not going to digest your food well. And so now you are creating, in a lot of cases, you're making things worse because you might be turning off the reflux, but what you're ending up doing is you're preventing your body from being able to digest protein. And when we don't digest protein and we don't just digest our food in general, it ends up overfeeding the bacteria. So he's eating this. He's like, I'm eating healthy. I'm eating healthy food. And he's even intermittent fasting. So I said to him right away, how long is your intermittent fast? Because when a person intermittent fasts for too long, then, and this is what he's doing a 16-hour intermittent fast, which for some people is okay. I don't want to say that 16 hours is not okay for everyone, but what I see is very often, if you're doing a 16-hour fast every day, if you start to feel bloated, what's happening is you're ending up shutting down your digestive function, and you're going to be when you do eat, you're overfeeding your bacteria. So he has this perfect storm going on. He's taking antacids for reflux from the gastroenterologist, which end up causing him to, everything he eats is just feeding the bacteria. He's intermittent fasting too long, which also only makes it so his digestion's not absorbing nutrients. And instead, when he does eat, he's overfeeding the bacteria. And he's taking a probiotic and prebiotic, which is only going to overfeed those bacteria more. No wonder he's so extremely bloated and feeling completely overwhelmed, where he's calling me for an urgent appointment on a Friday afternoon saying, what do I do? So in his case, I say, you got to cut back on that intermittent fasting. He's got to cut it back to maybe 12 or 13 hours. And spread his meals out a little bit and make sure every single meal contains protein. And then we got to go back and say, which are the foods that are really triggering? And let's get a stool panel to see which bacteria are overgrowing so I can help address them. I got to start putting out the fire, so to speak, and helping him get his food digesting. So it's multiple things we have to do at once, but it's all doable and possible. But I would say it can be really challenging when you're on your own, because like these patients, they're like, well, what do I eat? What supplements do I take? What doses, when? And so to do it on your own is overwhelming, especially when you don't feel good. So this is why I can give a specific protocol, because I helped myself heal from leaky gut and all of these symptoms years back. And I've been helping patients with this for over 2 decades. So I know what to do. Like, I know here's the supplements that are going to be most effective. Here's the doses that are going to be most effective. Here's the sequence that's going to be most effective, so that I can give these patients the help they need. He should be feeling much better within a week. And then I'm going to be guiding him over the next month so that he can get all the way back to feeling good again for his digestion. And not only that, but as you improve your digestion, now you're optimizing your blood sugar levels, and you're preventing heart disease and diabetes and cancer and dementia. Good stuff happens when you heal your gut, and you can turn off autoimmunity like these other cases that I mentioned. So I just wanted to share that with you, because I want you to know that you're not alone. Like, these are the cases I work with. Another case yesterday is also autoimmunity, and I helped her to, she had Graves' disease. We calmed down her thyroid antibodies by healing leaky gut, and now she's 12 weeks pregnant. So we're celebrating, because for her to be able to get to a healthy pregnancy out of the first trimester, prevented a miscarriage, and she's not on any medication for Graves' disease. We were able to get the autoantibodies to turn off. So these are like remarkable things that you don't usually hear about in the regular doctor's office, because these are the kinds of things that I know how to solve. We can, and it comes back to healing the gut, which is why I emphasize that for all of you. So if you're struggling with whether it's digestive issues or not, maybe it's just autoimmunity, maybe it's fertility, maybe it's hormone balance in general, maybe it's migraines like I had, whatever it is, maybe it's skin rashes. and you're like, I can't get to solving this, no matter which practitioners I'm talking to, then you can reach out to me. You can work with me one-on-one. And I am offering right now the Leaky Gut live program where we're going to work in a group, weekly sessions. Each week, I'll be meeting with you and guiding you through my protocol step by step so that you can know exactly which foods to avoid, what to eat, which supplements to take, how to balance your gut bacteria, and how to maintain over time. And I'm just so excited because I know I'm going to be transforming so many people's lives and health in the next month with this 4-week Leaky Gut program. And the thing is, I'm offering it at way lower cost. Yes, you can always work with me one-on-one, but I'm saying, hey, I can deliver this program to a group of people. And so each of you ends up paying less. There's even a 2-pay option for this program. So you're going to be paying so much less to get the benefit of this leaky gut healing protocol. I actually can't even believe, I'm so excited that I could be helping more of you in a group to be successful. So I hope if this is resonating with you that you sign up so we can get started getting you feeling better. I can't tell you how many people are saying, all these patients yesterday talked to me about how much the pandemic affected their health. They gained weight. They got autoimmunity. They're in pain. They're getting inflammation. They're getting these different symptoms through this stress of the pandemic. And they're like, okay, I need to take my body back and get healthy again because I have my life to live. And so I know that a lot of you listening also have things fell behind during the pandemic, and now it's time to get things back on track again. And I'm here to help you do that. All right, so I'll put a link so you can sign up for the Leaky Gut program, or definitely just reach out to my office if you have any questions about how I can help. I'll talk to you soon.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdoni.com.